Endocarditis. Endocarditis is a serious medical condition that occurs when the inner lining of the heart, called the endocardium, becomes inflamed. The inflammation is usually caused by an infection, which can be bacterial, fungal, or viral in nature. If left untreated, endocarditis can lead to serious complications, including heart valve damage, sepsis, and even death. The pathophysiology of endocarditis involves the development of an infection on the inner lining of the heart, known as the endocardium. The infection can be caused by bacteria, fungi, or other microorganisms that enter the bloodstream and attach to the heart valves, which are the structures that regulate blood flow within the heart. Once the microorganisms have attached to the heart valves, they can grow and multiply, leading to the formation of a mass of bacteria, known as a vegetation. The vegetation can damage the heart valves, causing them to leak or become stenotic, and may also break off and travel to other parts of the body, leading to the formation of emboli. The inflammation caused by the infection can also lead to the formation of scar tissue, which can further damage the heart valves and lead to complications such as heart failure. The severity of endocarditis depends on various factors, including the type and virulence of the infecting organism, the duration of the infection, and the individual's immune response. The symptoms of endocarditis can vary depending on the severity of the infection and the underlying cause. Some common symptoms of endocarditis include 1. Fever. 2. Chills. 3. Fatigue and weakness. 4. Muscle aches and joint pain. 5. Night sweats. 6. Unintentional weight loss. 7. New or changing heart murmur. 8. Shortness of breath, especially during physical activity. 9. Swelling in the legs, feet or abdomen. 10. Blood in the urine. 11. Small, painful red or purple spots on the skin, inside the mouth or on the whites of the eyes, known as petechiae. 12. Sudden onset of confusion or other mental changes, which can occur if the infection spreads to the brain. It is important to note that not everyone with endocarditis will experience all of these symptoms, and some people may have no symptoms at all. Additionally, some of these symptoms can be caused by other medical conditions, which is why it is important to seek medical attention if you are experiencing any of these symptoms. If left untreated, endocarditis can lead to serious complications, including heart damage, sepsis, and stroke. Diagnosing endocarditis typically involves a combination of medical history, physical examination, blood tests, and imaging studies. Medical history and physical examination. Your doctor will ask you about your symptoms and medical history, and will perform a physical examination, including listening to your heart for any abnormal sounds, murmurs. Blood tests. Blood tests can detect signs of infection, such as an elevated white blood cell count or an increased level of C-reactive protein, CRP. Blood cultures can also identify the type of microorganism causing the infection. Best initial test. Echocardiogram. An echocardiogram is a non-invasive test that uses sound waves to create images of your heart. It can help detect any abnormalities, such as damage to heart valves or the presence of a vegetation. Transesophageal echocardiogram, T. This is a specialized type of echocardiogram that uses a small probe inserted into the esophagus to provide more detailed images of the heart. Electrocardiogram, ECG or EKG. This test records the electrical activity of the heart and can detect any abnormal heart rhythms or changes in the heart's electrical activity. Chest X-ray. A chest X-ray can help detect any fluid buildup or other abnormalities in the lungs or heart. CT or MRI scans. These imaging studies can provide more detailed images of the heart and surrounding structures, which can help detect any abnormalities or complications. The treatment approach for endocarditis can depend on the severity of the infection, the type of microorganism causing the infection, and other factors such as the patient's age and overall health. Antibiotics. Antibiotics are typically the first line of treatment for endocarditis. The choice of antibiotic depends on the type of microorganism causing the infection, and may be administered intravenously, IV, in a hospital setting. Surgery. Surgery may be necessary in some cases of endocarditis, such as if the infection has caused significant damage to the heart valves. Surgery can involve repair or replacement of the damaged valve. Supportive care. Supportive care, such as oxygen therapy or intravenous fluids, may be necessary to manage symptoms and prevent complications. Anticoagulants. Anticoagulants may be used to prevent the formation of blood clots, which can occur as a result of the infection or as a complication of treatment. It is important to seek medical attention if you suspect you may have endocarditis, as early diagnosis and treatment can help prevent complications and improve outcomes.